2 years ago, I taught a live stream on breathwork and myofunctional therapy, and I still very much believe that breathwork can be a powerful tool. But if I had to teach that lecture again today, which I will, I would do it completely differently because breathwork is genuinely not the goal for myofunctional therapy. Regulation actually is, and autonomy of such. And so, as a different set of goals, I think it's important for all of us to know whether the patient needs to be upregulated, downregulated, what autonomic nervous system they're in, and how we can best support them as therapists. With that, I'll let you know that this was a very, very good lecture. Deep breaths, big impact. So if you can go back and watch it, it's worth it. But outside of that, I'm Carice Laguerre. I'm your Myo best friend. I am here on a relatively reasonable, regular basis to give you free education on all things myofunctional therapy. There's not enough quality education. In fact, most of the education that's out sounds pretty much the same. Nobody's really talking about anything new, unique, or different. And so I try to come at it from a perspective where we can elevate to excellence as a unit. Like, we all need to be better. And we can only get better if we are actually striving for that. And so let's just keep this thing going. If you like free education, if you like learning, if you like being the best you can possibly be, then like, comment, subscribe. If you're watching on LinkedIn, connect with me. If you're watching on YouTube and you're not subscribed, you need to be, because these are not as regular as they should be, and you don't want to miss out on any of the education. So subscribe so that you get notifications anytime something new is uploaded and you'll be ready to watch. All right, breath work. Many times when people are talking about breath work, it is more so about how we are able to help our patients achieve goals for myofunctional therapy. But I'm less interested in types of breath work this time around, and more interested in just giving you a set of resources and tools. So, safe, repeatable breathing methods and tools so that you can help your patient shift their status and be able to be completely ready for your care, whatever that is, because breathwork is valuable. As a former clinical but still licensed dental hygienist, I will say that it's very, very useful in the dental chair too. Sometimes you can just take a minute and use a breathwork technique and just ask the patient, let's just take a minute. Our bodies need to regulate and just need to be set and stable and prepared for what we're going to do. And when you do that, you're able to give those anxious, really tight, hesitant patients the ability to really calm and to have autonomy of their own ability to regulate themselves when they're there. I know they hate the dentist, they hate you, they don't like coming, yada, yada, yada. But if we can shift their energy prior to starting, it is the best way to start out an appointment. So, breathwork is a really valuable and vital tool. When it's myofunctional therapy, a lot of the times our intent is just laser focused. We are 100% like goal, eliminate mouth breathing. What you have to remember is that mouth breathing is sometimes physiologically necessary. So sometimes it's important for your patients to mouth breathe. There are some very popular breathwork modalities, and one of the biggest ones within airway is exclusively nasal inhale, nasal exhale. Sometimes we should be taking a mouth breath. Sometimes we should be doing a mouth exhale. Being able to regulate between the two and understand which is which, that's important. But when we're laser focused on eliminating mouth breathing, we assume all things mouth breathing are bad. Physiologically, though, mouth breathing is kind of like our emergency. Like, it's that glass box where it's in case of emergency, break glass, breathe through mouth. And there was a wonderful analogy that I've had for the last 2 years that I'm going to use with you today, that mouth breathing, when it's prolonged, is detrimental. And many of you know this, but when it's prolonged, it's detrimental. It's kind of like trying to drive a car on all four spare tires. So we have one spare tire in case of emergency, but spare tires are not meant for long term travel. If you had all of your tires as spare tires, you can't drive nearly as fast. You wouldn't have the same level of traction, and you for sure would be doing more damage to your car than good, I can only assume. So even if you had a Bentley or a Bugatti on all four spares, it's really not nearly as valuable as being able to have like a Toyota Camry on four regular tires, right? So when you have your body and it's not working optimally, so your body could be the Bentley, you feel like the Bentley, and you feel like your health is great, but you're riding on four spare tires and you're doing that for a long time and it starts to compound and you start to feel the effects of that, that is when we have the biggest issue. So our mouth breathing prolonged is a problem, but physiologically, sometimes people need it. We want predominant nasal breathing. Yes, 100%. I'm all down for all things myo and understand airway. It's just you can't be laser focused on it. It's going to be something that you will need to be able to modify from here and there. Okay. I have a wonderful quote that I used in the last lecture that I'm bringing back. Max Strom, a very, very insightful and wonderful person to listen to. He's got a great TED talk on YouTube and he has a lot of other talks, but a big, impactful breathing and yoga teacher. Love this quote. Some doors only open from the inside. Breath is a way of accessing that door. We are trying to open up doors within our patients, within our clients for myofunctional therapy through breath work. And you can only open that oftentimes with the ability to know how to stimulate appropriately your breath work or where your status is, your breath work status. So, breathwork can be a vehicle for us to make impactful change in anxious patients. So, sometimes they're anxious coming into a clinical environment. And I talk about this a lot whenever people ask me why I do mobile myo. I do mobile myo because I genuinely like it. I like driving around, and that's something my dad did when he was a worker, when he was back in his heyday. He drove around and always saw clients. I got to ride along with him sometimes and go and do those things. So I think that was kind of already like built into me. But I really like going to my patients. When you get to their space, you're in their space. It is harder to be anxious in your home when someone's coming into it, with the exception of like I'm big, very big guilty on this, when like you're like, oh no, they're gonna see like that dust there on that, uh what's the thing on the board, the drywall, they're gonna see something, the dust on the little board there. It's like, oh no, nobody's looking for that. But outside of that, you can be more anxious walking into a clinical environment than you are having someone clinical walk into your environment. So when you have the ability to really understand that, yes, this is something that, I'm now taking a wall away from people that they would have had up. A mobile mile really doesn't sound that bad. But when you're in a clinical environment and people come into you, sometimes they come in and they're already anxious. They don't know what to expect. They probably only recently heard about myofunctional therapy or they're still relatively new to it. Or dentistry, high levels of people coming in that are already anxious. You can use breath work as a vehicle to down regulate them so that we can eliminate some of that anxiety. And yes, I will be giving you tools for this and different types of techniques or breath work that you can use. If they have a hyperactive gag reflex or they present orally defensive, those of you who are doing your broom screenings, you know exactly who we're talking about when we say oral defensiveness. Poor compliance. If they are not actually making true progress, sometimes I stop everything. Okay. So if we're doing just regular myo, like we've moved past the cranial nerve stuff, we haven't been doing any sort of movement, or we've moved on from primitive reflex integration, and now we're just doing myo, and somewhere along the way they lost their motivation. Awesome. Here's what we're going to do. We are going to shift our focus, we are going to reset, and we're going to do some breath work. That way you can be in control of your body, you can get your awareness of that control of your body and your energy and how all of that works together, and then we'll get back into our myo. That poor compliance, it's a really actually powerful tool, breath work, because they still feel like they're accomplishing things because you feel the shift in real time when you alter your breath. Inability to retain instructions. This is so big for so many of those pediatric clients when you're working with children and they just cannot get what you're trying to tell them a lot of times. And I have so many tips and tools. There's so many videos here in this YouTube library. So go back if you need to get some of those. But just to give you one or two, it's a really powerful thing to be able to reset them and to help them achieve a state where they're attentive and they can be able to really like be with you and they're out of that ventral vagal state. You are able to also get them to retain instructions by just breaking it down a little bit simpler. Like instead of a 4-step process, make it 2, and make each of the 2 steps really, really important and powerful. Okay, then you can move on to the last 2 steps next time you see them. It's definitely a vehicle for mouth breathing, but that comes with a caveat. You have to know that they're able to sustain nasal breathing for some prolonged period of time. If you meet them and you're doing your evaluation and they cannot breathe through their nose for any lengthy period of time, they are fully congested or fully blocked or whatever, you're not going to be able to do anything with breath work except cause negative side effects. And yes, breath work has negative side effects. You can make someone dizzy or alter their psychotic state. You can like really change their mental health in the middle of breath work. You can alter their blood pressure. You can alter so many different things. You don't want to go there. If they cannot nasal breathe for any lengthy period of time, at least 3 to 5 minutes, then don't even think about breath work. But if they can, and they're just struggling with being able to switch it on and off, that emergency mode of respiration, mouth breathing, then you need to 100% be able to use breath work as a tool to help them start to overcome that. Low tongue posture, many of the times you can do static breathing. I have one exercise I call caveman breathing. We don't even talk about that in this lecture, so I'll just bring it up really quickly. But caveman breathing, where we're in a cave, so you're in that lingual palatal suction and you have that sealed and you're breathing through your nose. And even if you're just counting that out for 30 seconds, you throw a timer on for 30 seconds, or you put them on vibration plate, or you're doing something, or you put them on a balance board, it's a great way to start stimulating that tongue posture, stimulate the nasal floor, get the breathing going. Sleep and airway conversations are often sometimes traumatic, and it can bring up a lot of anxiety. And so you can use that as a way to introduce, okay, breath work is a great way for you to start stimulating sleep for yourself. So if you're having trouble falling asleep, there's some great ways that you can kind of downregulate and get back into a good dorsal ventral, dorsal parasympathetic, dorsal parasympathetic tone. There you go. Trauma informed care. I'm going to save that because we're going to get into that trauma informed care. And if they're really nervous and they're not really ready for a therapy, or they're not ready for their dental appointment, you could do a breathwork appointment in dentistry. Now, will all of your practice owners love that? Probably not. Probably not. But if you have somebody that you need to tiptoe around and you know that they're just not ready yet, and sometimes that's pediatric in nature, sometimes we do a happy, positive visit. That way they can come back again and maybe the wall is down and they will sit in the chair and they will do what you need them to do. So you can get them ready by using breath work. So if you just start off with some breath work, the child is not going to be as hesitant to come back for the next one. I need you to know that breathwork is not for everyone. I need you to use the power of discernment. You're always, always, always going to be asking yourself why you're doing something. I have a big, big issue with myofunctional therapists considering themselves myofunctional therapists when they don't know why they're doing what they're doing. If you're just following a plan that somebody gave you, and you don't know how to look at a person, how they present, and what you need to choose based on what's in front of you, we have big, big issues. You're not a therapist. You're a distribution network for a set of exercises that they really could have just went to YouTube and looked up. Like, they didn't need to spend the money for that. But if you are an actual therapist and you're able to look therapeutically at someone, you're going to know and be able to discern who needs breath work and who needs to just be going a different path or a different route, whether that's myofunctional therapy or cranial nerve integration, or you're just doing a movement session. You might just be doing yoga with them. You might just be talking hormones. You might just be doing something other than active myofunctional therapy because you know that that's not what they need at that particular time. Okay. And I'll tell you what, as a mobile therapist, I can't tell you how annoying it is sometimes to show up and somebody you know is not ready. They're not ready to move on from the next steps, but you've just drove 40, 45 minutes. You wind up in their space and like, they're just not ready. Something traumatic just happened and they're set back. And you need to know how you can navigate that. Is it breath work? Is it maintaining the same set of exercises? Is it just having a talking session through what's coming up, any blocks that are coming up for Myo based on what's going on in their life? So it's not for everyone. Please use the power of discernment, but no deeper than that anybody who is experiencing shortness of breath or hyperventilation, so should you meet them and for whatever reason they are clinically at your doorstep for myo or for dentistry, but they have you're going to make it worse if you start introducing breath work. Do not introduce breath work. That is not the time to try to shift them. Yes, I get it. Very much they're in sympathetic tone and you want to change that. Do not. You will likely make it worse and you can cause them to go into. Listen, if you're not prepared for whatever might be the repercussions of the action, don't even go there, right? So you might cause them to go into a cardiac event. Do not. They might develop angina. Like, you don't want that. So don't go there. If they have a history of stroke, a heart attack, high blood pressure, I would navigate cautiously. If you're taking blood pressure before you're starting anything, then absolutely. If they have well managed blood pressure and their blood pressure is normal, absolutely. But if it's not well managed with medication, or they're trying to manage it with diet before they go on medication, or they're trying to whatever, do not pass go. Do not collect $200. Like, cut it right there. You're not doing breath work. You're probably not doing myofunctional therapy either. But antipsychotic medications, you can alter a mental health state really by increasing depression, and you can have a lot more anxiety that starts to build up with some breath work methods. So do not do breath work with those people. Pregnancy, you're more likely to get an adverse outcome in a pregnant patient than you are in a non-pregnant patient. So just don't go there. I wouldn't want to be responsible for anything that happens to anybody who's pregnant or what happens to the person they're growing inside of them. So we're not doing breath work. We're probably not doing myo either while you're pregnant. Glaucoma, pressure-based eye symptom. It's you do not 100% want to do anything with breath work. You can increase the pressure behind the eyes, and that is not going to be good. In addition to, they won't be able to take as deep of breaths. So some of your breaths that you're doing and you're trying to navigate, just don't go there. Okay. So take heed when you see somebody and they present with any of these, or something just seems off, it's probably not the time to introduce breath work. If they come and they're presenting as reasonably healthy with no medical history of glaucoma, they're not on any psychotic medications, they're definitely not pregnant because maybe they're a gentleman and you know that they're not pregnant, um, you should know that, okay, I might be able to start and to tap in and determine what I want to do next from there. But what you really need to know is that breathwork can be a way to kind of put the switch on and off between your autonomic nervous system states. So between parasympathetic and sympathetic, and in some ways between dorsal and ventral parasympathetic. So being able to regulate between that fight or flight or rest and digest is the key here, okay? Because most of our respiration is governed by involuntary brainstem controls and voluntary controls. So you have the ability to, yes, when we're not thinking about it, we're still breathing. We're still got that going, but you are able to control it. And then once you start getting into some of those cortical systems, you're deliberately now going to shift the autonomic tone. Now, why on earth would you want to shift the autonomic tone? You're like, like, why would I want to take somebody who's in a sympathetic state, move them to parasympathetic? Or parasympathetic sounds actually pretty good. Why on earth would I want to take them into sympathetic state? That seems like I'm causing them distress. That's not necessarily the case. A lot of times you might get somebody who's in that ventral system where it's more like the freeze, right? So instead of fight or flight, and you think about that as its own separate entity, then there's social engagement, which might be more of your parasympathetic, and that's the dorsal system. But the ventral system of the parasympathetic, now you're going to go into this tone where they are in freeze. Trauma responses, a lot of times, and many times, I have a whole lecture on trauma here, which I'll probably redo that one too, because that's probably about the same amount old as this breathwork one that I just redoed. But what we want to make sure is that when we are looking at the trauma responses, a lot of times, sometimes what we do in working in this very sensitive area of the body where a lot of trauma may have occurred. So there are head and neck injuries and a lot of domestic violence or accidents or sports injuries. There's a lot of traumas that occur, um, abuse. I'll leave it at that. When there are traumas in this area, sometimes when we're working in this area, we will involuntarily bring up those traumas. And that may shut them down and bring them into that freeze state of the vagal tone. When they're in that freeze state, that's more of that parasympathetic. If you're going to get anything accomplished with them, even if you're trying to do like one exercise or you're trying to teach them some nasal hygiene or something, you're going to need to shift to that sympathetic state to kind of turn them on. They're disconnected, they're detached, they're not with you, they're not socially engaged. You need to shift where you are moving your focus. So now we're going from parasympathetic to sympathetic, and that's okay. Don't feel like you're doing something wrong when you're doing that. Some people need to be able to shift into social engagement, being able to be aware and with you and not shut down and frozen. Other times you might just want to reschedule, like if you really don't get it. But when they're in that sympathetic nervous system, you're going to find that there are more increases in breathing and respiration. So there's sometimes more of those anxious patients or the nervous patients are over breathing, shallowly breathing, chest breathing, their airways more patent, their heart rate's up. And so you're going to want to shift them to the parasympathetic. When you're shifting to parasympathetic, then you're going to be able to turn on some of the things like concentration, ability to focus, and you're going to make sure that they're able to be in an emotional state that they can be with you. Okay. They need to be present in order for anything that we do to work as myofunctional therapists. And for a lot of what we do in dentistry, you're going to have somebody engaged and cooperative with you. Otherwise, you're not going to get any progress. So being able to know whether you need to upregulate or downregulate, incredibly important. I can't stress that enough. Okay. So let's dive into a little bit of technique. What do you do and when, so that you can shift them from sympathetic tone to parasympathetic. So when you are in sympathetic tone, you probably need to remove more carbon dioxide, and that's going to help improve your vagal tone. So that'll take you up the ladder on vagal tone towards being socially engaged. It's going to slow down that heart rate that is very fast. It's going to increase your heart rate variability, and it's going to eliminate that carbon dioxide that I just discussed. So there's a couple of ways that you can do this, a couple of breathwork techniques, and this YouTube is meant to be purposeful. So you can take one of these exercises and do them at the start of a dental visit or at the start of a myofunctional therapy visit if you find that you are met with a person who needs it. Okay. So the physiological sigh, sometimes, physiological sigh. It's 2 quick nasal inhales, 1 long exhale through the mouth. We're eliminating carbon dioxide. I don't care how you feel about mouth breathing. We are going to eliminate more carbon dioxide by exhaling through the mouth. Okay. If they have really enlarged tonsils, they might struggle with this because there's just natural blockage there. And so they have difficulty getting it through. Tonsil stones, sometimes this one might be a little painful. So do not go there if you don't know about the tonsils. But 2 quick nasal inhales, 1 long exhale. 4 or 5 typically does it. Great way to just start shifting things. If they start feeling lightheaded, you've done it for too long. Sometimes people would want to put on a timer and be like, oh, 30 seconds. Like, let's go. We'll do it together. And then they report back to me like, oh, we did it. And like, I didn't like that. Like, it made me feel lightheaded, or it made me feel dizzy, or it made me feel whatever. You should not feel any of those things. So 4 or 5, really great way to get through a physiological sigh and move from sympathetic to parasympathetic. Next up, your 4-7-8. 4-7-8 is a breathwork technique where you are going to be doing the same thing, expelling more carbon dioxide, but you're building up what you've got as your reserves. So if you test and do capnometry, you'll definitely see it physically because you'll be able to see that there is a build and then a release of carbon dioxide. But you're going to inhale for 4 seconds. So for a count of 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. You can tell that I work with kids, right? Because I had to put those Mississippis in there. Because if I tell you inhale for 4 and you just go 1, 2, 3, 4, that is not a 4 count. That is not a 4 count. It's never been a 4 count. Okay. So inhale for 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Hold. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, and exhale 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi. Repeat. So then you would inhale again for 4 seconds. Hold for 7 seconds, exhale 8 seconds. And so you can do a couple of rounds of those. That is also another way to make that great shift. And it's distracting to the mind as well. So anything that was very anxiety inducing, like sitting in a dental chair, suddenly becomes just a little more tolerable because mind has just kind of shifted from what were we doing again? I don't remember. I just feel like this sudden state of calm, like it just comes over them really quickly. And so it's a really great way to just start out some things. Bumblebee breath for the kiddos. So if you work in pediatrics and you're like, there's no way I'm getting these kids to do some of these things, I'll tell you, it's easier than you might think. And there's some really great books, some really fun books that have a lot of breath work for kids as well. But bumblebee breath, you want them to inhale for 4 seconds, and they're going to exhale to completion while humming. So they're going to exhale however long. Let's see how long your bumblebee can fly. We're going to inhale for 1, 2, 3, 4, bumble. And they nasal exhale the whole time while they're humming. And then we're going to inhale again. Like, that was great. Inhale. And we just continue on. This one's really fun. I have this one with, if I'm doing it with children as a part of like Myo, I'll extend it. So we go 2 or 3 minutes and it's like, let's see how long we can get our bumblebee to fly. Let's see how far our bumblebee can go. Just as long as you're constantly checking in. You just need to know that they're not feeling that dizziness, that lightheadedness, that so forth. Okay? That none of that is occurring. All right. Next up, our parasympathetic shift to our sympathetic. So if you find that they're detached and you need them to shift over, well, what you're really going to do is you're going to induce hypocapnia. So you're going to activate decreased carbon dioxide, but triggering epinephrine release because you lose a little bit of the oxygen too. Bellow breath. So a bellow breath is a very interesting technique where you're going to take rapid nasal inhales and exhales, but they have to be even. So I typically like to go with 2 as your number. So 1, 2, 1, 2, 1, 2, 1, 2. I count it out. If you just keep this in your head, my 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. You can try it and you can do it. If you're watching it on replay, you might want to just go back and try it. But you're going to shift. And it brings you to a state of neutral where you're not overactivated. We haven't done anything that would shift you cardiovascular wise. So we're not impacting at all your blood pressure or your heart rate variability. And we are in no way, shape, or form doing anything that's really going to, relax you too much. It's a lot of just kind of fluttering almost. And so it brings you to a state of neutral. And so I love that. Neutralizing the autonomic nervous system so that you're not in parasympathetic or sympathetic. You just want to increase your intrathoracic pressure and blood pressure at the same time. Okay. And that's like, oh, that seems really like, wow, why are we doing that? We would do this again, a state of just absolute neutrality. And so it's almost the same as trying to move them from parasympathetic to sympathetic, but it's really just you're not moving and to shift in either direction. You're neutralizing. Box breathing. Box breathing, you're going to inhale for 4 seconds. So a count of 4, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Hold your breath. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Exhale. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Hold your breath. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. Okay, that way you get that all together. Rhythmic breathing is another way I like to go neutral, and this works really great in a lot of dental practices. And when I go out and I consult and whatever, I love that because a lot of practices have music on overhead. So when you have music on overhead and it's something calming, most offices, I've never been to an office where they're playing heavy metal. And so as long as they're not playing like electronica or like heavy metal or something that's way too slow, like folk music, if they're in that beat range, which most pop music is, once you start like really paying attention or you Google and start to look up songs that are in the 60 to 80 beats per minute range, you'll find that most pop songs are pretty much there. So if they're playing pops or like, the oldies or like whatever, most of them are within 60, 80 beats per minute. So just allow them to listen to the music, take in the music, and allow their breath to shift or dance as they will to the music. So this is going to be a really good neutral because it's not a breath hold, and it's not necessarily exhalation extension. It's you moving as you feel so motivated. So sometimes you might have a short breath hold. Sometimes you might take rapid, shallow breaths. Sometimes you might take a deeper breath. Sometimes you might exhale more. It's going to be variable. And in that variability, if you allow yourself to just complete the song, most songs are roughly under 4 minutes. If you just allow them to just kind of complete the song, even if you catch it halfway through, you can find them at a state of neutral engagement. Okay. Awesome. Okay. This simple thing that if anybody wants to, do a screen catch, like screen grab or whatever, this is a great one. So when you see them show up and they're in your chair, in your space, in your clinic, in your myo office, anxious, guarded, or they have hyperactive gag, they probably need to be down regulated. So bumblebee breathing, 478, rhythmic breathing, great time to introduce those. If they are down regulated and almost in that frozen state, you want to bring them up, sympathetic. So move, increase the breathing, and do the Qigong style patterns. Qigong, I talk about and demonstrate in the older video. We're not going to get into that right now, but movement, getting them to move a little and or move and shift the breath like we did with our bellows. Mouth breathing. When they're mouth breathing, you can just bring more awareness to the nose by just focusing on any sort of breath work that's going to stimulate them being able to use their nose as the primary source of respiration. I love doing passive nasal breathing with quiet breathing, otherwise known as Lois breathing. Shout out to Lois Laney. Tongues up on the stick like a ramp. So I like to start with the tongue up. Tongue now sits as a ramp, lips hold, the teeth are not on the stick at all. Okay. So just doing some quiet, passive nasal breathing while you're doing something else. I always encourage people I work with to read, cook, do homework, color, screen time, whatever. When you're doing that quiet breathing, it's a focused, non-conscious, proper oral resting posture, but it's passively nasal breathing. If they have history of trauma, we do not want a breath hold because most times with trauma, they are already breath holding. They've had a history of breath holding in active, distress. And so you don't want to do that. Extending out, humming, doing activities such as like a deep nasal breath and some gargling is a really powerful thing. Doing some of that rhythmic breathing is really helpful too because it just disassociates the body from the breath. As much as it is you actively controlling your breath for the song, it's also disassociating the body from the trauma of the breath and breath holds, because breath holds do hold a lot of information for the body. As soon as you're in a breath hold, you're kind of already stimulating a lot of that sympathetic nervous system reaction. Okay, a good way to kind of know if you did what it was that you were trying to do. Like, did I hit the goal? Did I make the mark? Well, you got to look. You got to look. You got to know how to therapeutically assess. You got to see, what was I going for with this breath work? And did I achieve it? We talked about the different ways that you can move and manipulate. Are you making them get any closer to that goal? Are you seeing a progress in a session as a myofunctional therapist? Is there behavioral shifts and change that happen? Or if you're in a dental environment, did you see a shift, a change in their reactions, their mannerisms, their defensiveness, their connection with you, rapport, in their rapport with you? Do you see a shift in that in the few minutes that you've been working with them? It's incredibly important that you're able to look, to see, to assess, to determine what's going on. What is it that I am actually going for? And have I met that goal? And when you are seeing improvements, it's going to look like a decrease in their hyperactive gag, an ability to not breath hold during an exercise or the shallow breathing, will stop being so shallow. They'll breathe a little deeper, a little bit more comfortably. They'll be a little bit more cooperative. You're going to see that they're more attentive, that they are just more aware, and that they're able to follow through and to continue to do what it is that you're asking them to do. So that's that compliance, being able to work the program and work with you. But most important is just really understanding that breath work is not about giving every single patient a breathing exercise. Not everybody needs it, and there's a good set of people who you should not do breath work with. But it's about being able to read the room, reading and understanding the patient, their body, their state, and choosing with a level of very functional discernment the state that would be the safest and the best for you to activate so that they can be in full awareness of what they are doing collaboratively with you, because it's you and them together. Okay, it is not just you, it is not just them. You're working together. And breathwork is just overall a tool. So it's not just any one method. I think a lot of times that gets lost in a lot of what we do as myofunctional therapists. People assume, like, oh, I have to learn this one breath work, or I have to learn a couple of breathing exercises, or there's only this, that, or the other. Like, no, there's dozens of breathwork modalities and so much that can be brought forth from that. And that's why there's going to be a whole breathwork engagement section and seminar in our Myopinnacle intensive. It's a 2-day intensive, the end of April into the first day of May 2027. You can visit myopinnacle.com to kind of learn more about that. But breathwork can be a powerful tool. And if you're going to be there in West Palm Beach, I will see you there with bells on, and it's going to be a great time. Last up, just know that I do have a resource for you. I love free resources. I love being able to provide something that is going to give you some value. If you are doing breath work and you're like, I don't know how I would even document this, because documentation is very important. If you didn't document it, it didn't happen. And I think it's really important that if you are doing it in a clinical environment, like through dentistry, that if they are possibly going to be seeing somebody else at any other point in time and they want a reminder of, like, okay, we did this thing last time where we breathed and I don't know what we did, but it made me feel better. Can we do that? Like, there should be somebody able to open up your chart, open up your notes, or you should be able to open up your chart, open up your notes and see that. So I have some documentation samples. It's really just a single page PDF. And so you can take that, you can copy, you can paste, you can modify it, you can make it your own. That way you know what it is that you did with them and how they reacted, and everything can be documented appropriately. Just ask for that in the Myo community on Facebook. So the Myo community on Facebook. It's a Facebook group. If you're watching this on LinkedIn, just ask for it in the comments. Or if you're watching it on YouTube and you don't have either of those social media platforms, just ask for it in the comments and I'll send it to you. Okay. It doesn't cost you anything. And, it's a great resource to have. But with that, I want you to all breathe well, and be the best, most exceptional version of yourself for your patients, because they deserve nothing less. Do not be average. Being average is not the same as like being burnt out and tired of like what you do. Just being average is giving up on them. And so be exceptional to the very last day that you're working with someone. It is the only way that we should all really be and be engaging. And with that, I bid you adieu, my Myo best friends. Until next time.